Hi, I'm Babette Edgar, and today we're talking with Diane Ramey. Diane, can you tell us a little bit about where you work and what your job is, please?
Sure. I work with Solid Benefit Guidance. I am in consulting. I'm the VP of Medicare Consulting and Account Services. My focus is really on Medicare compliance and government services programs, Medicaid and Medicare.
Great. I know you've worked in managed care and Medicare for a long time, and I just wanted to ask you a couple questions about your thoughts on some of the issues for the future. Who do you believe will be the employers of the future for managed care pharmacists, and in what areas do you think they'll be working?
I think the majority of them will obviously be in the healthcare segment, primarily in the managed Medicare and Medicaid with the Medicare and the integration of the Medicare and Medicaid. I think there's definitely potential for a large growth within that segment for the pharmacy population. I also see the specialty pharmacy emerging as well as opportunities for pharmacists to get into, similar to the fact that pharmacists are going to be playing a more integral role in overall healthcare, in cost containment, as well as improved patient outcomes, and working side by side more closely with hospitals and pharmacies, and physicians in order to kind of prescribe and be part of that overall improved healthcare outcomes.
Mm-hmm. And do you see areas like accountable care organizations and patient-centered medical homes sort of promoting managed care pharmacy and the different things that we could be doing in those areas?
Yes, definitely. I think one of the areas that I've focused on is in the state of New York. They have the FIDA, which is the long-term care services, mm-hmm. and integrating that piece into it as well. I think there's a definite role there for pharmacists to become involved in that. What they're trying to do is contain the cost for anyone that's getting these long-term services outside the home, including prescription regimens and so forth. So I definitely think that there's a potential for large growth in that area as well.
So with all of the new areas that pharmacists could become involved with, do you see a need for the change in the way that we train our pharmacists, either at the college level or the postgraduate education level? And do you see any types of new educational needs that might be there for the future for pharmacists to take on these jobs?
I think that's a great question. I think, although I don't want to say how long ago it's been that I went to pharmacy school, I think that a lot of it is obviously concentric around the sciences as well. And I think that giving the students the opportunity to really kind of see the business side of it as well, the economical benefits and so forth, rather than just the medical side of it, it would be advantageous as far as kind of schooling and advanced degrees, is to kind of get that more comprehensive education around the financial impacts of things. I mean, when you get into things like rebates and understanding the financial impact and how what you're doing with that piece actually applies to the overall managed healthcare.
Mm-hmm. So I could see, there could be some maybe different courses, for example, within schools, mandatory and elective.
Right.
But so if we think about postgraduate education, right now there's managed care pharmacy residencies, and they're usually 1 year. But given all these different things that are occurring within healthcare, with the Affordable Care Act and with patient-centered medical homes, for example, do you see the possibility that there could be specialized residencies in managed care to focus on these particular areas?
Yes, I do. As a matter of fact, I just recently heard of a specialty residency program for basically it's a specialty pharmacy for chemotherapy management. And they actually do rotations through there. That currently they're really just using one pharmacy school, but to do a rotation that's more focused around that kind of management. And the principle behind that is that they really felt that there was a kind of a decline over the years with people living longer and cancer rates being higher, that there would actually be a need for pharmacists to play a more integral role in the management and the overall cancer treatment regimens for patients. So they actually do, residency programs and so forth. And they actually shared with me, I guess there's some type of certification that's in addition to your pharmacy degree that you can pursue to kind of be part of this kind of chemotherapy management team. So I think that there's opportunities. I think you'll see more of that as you try to do more in the outpatient setting, and having pharmacists play more of an integral role in that.
That's interesting. So it's not just the clinical role anymore. It has the business piece and the utilization management piece and combines policy as well,
Exactly.
is what it sounds like.
And I think part of another piece of it is more, it's a more hands-on. It's not kind of a 30-day supply, so it gets into the healthcare reform, trying to eliminate waste within the drug industry. It's more focused, and they're kind of more of a hands-on type approach. So you're not just having these supplies sent out, a 30-day supply, when the regimen, they might not be able to accept that regimen. It might be better off in a 7-day regimen. So there's really, again, cost savings to the health plan, as well as, if it's a government-funded program, to the government ultimately.
And I know, as we go out and we look for pharmacists, especially when we look at Medicare and Medicaid, you don't see pharmacists trained per se, in residencies for Medicare or Medicaid, although the need is becoming greater and greater to have those specialized skill sets. So do you think perhaps in the future that it's a possibility to have specialized residencies for Medicare, for Medicaid, for example?
Yes, I do. I think that if there was more of a push to have residencies within actually the health plans, a lot of the health plans are doing, commercial, they're doing Medicare, they're doing Medicaid, now they're Medicare and Medicaid are integrated, more residencies within the actual health plans themselves, as well as even in the PBM industry. I think that there are some PBMs that do residencies, but I think because having worked in that industry, there's more than just that clinical residency piece that could be done from a pharmacy perspective. It could be, much more detailed than just the clinical piece.
Great. Do you see any other types of organizations getting involved in managed care? For example, we know now when you think of managed care, you think of health plans, you think of insurance companies, you think of PBMs, employers to some extent. But do you see any other sort of allied healthcare organizations or any type of businesses because of the focus that's being brought into play with the business side of it, with the quality measures, for example? Do you see any other areas where you think, that managed care, other businesses might be getting into managed care?
That's a good question. I think more from the ancillary services outside of the managed care from a business perspective, similar to the ACO, where you're bringing that holistic approach into durable medical equipment, any type of outside services, having that more integrated from a business perspective, similar to what the ACOs are doing, where it's kind of all under one roof, so to speak.
Great. Well, thank you very much,
thank
Diane,
you.
for your time. We appreciate it.
You're welcome. Thank you.